The first description of dyslexia appeared in 1896. The word dyslexia is derived from the Greek word dys, meaning difficult, and lexis, meaning words or language. Dyslexia has no effect on a person's IQ. In fact, 25% of CEOs have dyslexia. Some of the most famous and well-known people such as Albert Einstein, Henry Ford, Leonardo DaVinci, Picaso, and many others had dyslexia. Well, how does dyslexia actually affect the brain? To understand this, we have to look at the brain in two hemispheres. The left hemisphere is in charge of speech, language, and recognition of words, letters, and numbers. The right hemisphere typically handles spatial activities such as creativity and emotions. FMRI imaging has found that individuals with dyslexia rely more on the right hemisphere in the brain and the frontal lobe. Research correlating to brain activity with reading has shown that individuals who do not have dyslexia have stronger activation of the left hemispheric reading system, including the left angular gyrus, corresponding to better reading skills. For individuals with dyslexia, the opposite was true. Increased reading skills showed greater reliance on the right hemispheric systems. There are three main types of dyslexia: primary, secondary, and trauma dyslexia. Primary dyslexia are hereditary and is passed on through genes. It does not change with age and is more common in boys than girls. Secondary dyslexia are caused by problems with brain development during the early stages of pregnancy, possibly causing impaired neurological abilities in word recognition and spelling. This type diminishes as the child gets older. Traumatic brain injury affecting areas in the brain associated with language processing can result in trauma dyslexia. Dyslexia can present in any age, however it more commonly presents in children. Symptoms often include difficulty learning new words, taking longer to learn how to speak, difficulty to distinguish between words and sounds alike, or reversing words. These symptoms may become more pronounced during school years, with individuals reading below their expected level for age, difficulty with comprehensive skills, finding it difficult to copy from the board or books, and to process that information. Early diagnosis is highly important in order for individuals to excel. Treatment relies heavily on support from teachers and family in order to help the individuals to learn at their own pace. Certain learning techniques, such as the Davis theory and methods, which involves both children and adults using clay to model the concepts that are associated with the word meanings at the same time as modeling the letters of each word in clay. These methods provide an easier route for learning to read for individuals with dyslexia than the more traditional ones. Neurodiversity highlights how we all have different brains and therefore have different learning needs. We should not let the rate at which we learn define who we are as individuals. We should embrace these differences and remember the potential for growth and learning is limitless for all individuals. Thanks for watching. Don't forget to like, comment, and subscribe.